one thing that I'm constantly advocating for, and so that our program is not rooted in white supremacy, is that we not only offer safe injection equipment to the community, but are we offering safer smoking? Are we offering safer smoking education? What what about our Black community that smokes crack? This is not just fentanyl has been proven to be in everything, whether it be crack, heroin, methamphetamine, cocaine, it's in everything. And so if we are only addressing the injection drug community, we are leaving out a whole demographic, which is the Black community, the stimulant use community. And so every time in my monthly reports, I'm just like, we are still not addressing. And that is a call for alarm, because we are harm reduction. We are not supposed to be inducing any harm in the program. We are supposed to be mitigating harm. And if we don't address the entirety of the drug use community, then we're perpetuating harm.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 60. Hi everyone, Umari Richards here. Thank you all so much for joining me once again. Make sure that you are subscribed, whether you're on YouTube or on a podcast platform, so you don't miss when these episodes drop. Make sure that you like this video if you're on YouTube. Make sure to review and share it with a friend. I greatly appreciate it. If you want to support, go to buymeacoffee.com/the PH Millennial, and you can support there. I greatly appreciate you all. I know this episode is great. If you're interested in harm reduction or anything like it, reach out to this person. She is amazing, doing great things, has great insights, and I'm really glad that I got to have her on today and that she was so transparent in her story. And there's just a lot that I learned and a lot that I think you will learn. And I hope that public health students get more interested in harm reduction work and we really get the policies that we need to change around harm reduction, because harm reduction is public health. So without further ado, here's today's episode. Enjoy. Today we have an enthusiastic harm reductionist, public health professional who is a US Marine Corp veteran as well as a certified therapeutic recreation specialist. She got her Bachelors of Sports Sciences at the American Public University, then went on to serve in the US Marine Corp for 4 years. She then went on to get her Master's of Public Health at the American Public University. She currently works as a harm reduction outreach coordinator for a nonprofit and an HIV STI Program Coordinator. You may also know her on Instagram or IG at Kristen_in a nutshell. We have Kristen Gonzalez-Soto, MPH. Welcome to the show.
Thank you for having me.
Yes. Yeah, I'm very excited because I know we connected a while ago, and you were one of the first people to actually ever send me like a voice note on Instagram. So I remember that very, very detailedly.
I love them, especially if I'm in a moment where things are just moving too fast. It's so much easier to just say hi with my own voice instead of typing.
Yeah, I definitely appreciated it, and I feel like it made more of a connection. So I appreciate you reaching out and doing that.
Absolutely.
Yeah. So how are you doing? How you been coping? I know you just got back from vacation. I don't know if that's oversharing. Sorry.
No, it's not. I think it's a part of it. We get into these spaces where we are working with the community. So vacation is I don't feel bad telling people, hey, I went on vacation, because burnout in this line of work is real.
Yeah, absolutely. And I know that I'm going to ask you a couple more questions about that later on when we dive into your story a little bit more. So tell me, how do you identify, and then tell us a little bit about your personal background.
Sure. So my pronouns are she, her, and I am 32. I am a mom to 3 tiny little humans who are completely amazing. I did serve in the United States Marine Corps, and then following that, I got my master's in public health. I am a queer lesbian and oh so proud, late to coming out. Um, I have battled with substance use and addiction, and that has kind of led me to where I am now. I am sober. I am working in my community, and yeah, just excited to be doing this work. Excited to be holding our legislature responsible for um, the health and wellness of our community.
Yeah, and just to dive into a little bit of that right now. Why is it so important for you to hold a legislator? Like, yeah, I don't know, just speak to that. Like, why is that so important to you right now in the work that you're doing?
Yeah, because we know that without funding for harm reduction, we know that without funding for addressing substance use, that overdose rates are going to continue to rise. After COVID, overdose is the second most thing killing people right now. It is our number one public health crisis after COVID-19. Um, so harmful drug policy started a long time ago, and those policies are still in place today, and they are what is still killing people. Um, I think it's important for policy change because not everyone makes it to treatment. Not everyone makes it through abstinence. So policy change that allows us to address substance use in a more holistic approach where we are meeting the whole person and keeping them alive where they are at right then and there, um, while we have discussions about treatment and recovery, if that even is what the person wants. But no one should have to die because of trauma. No one should have to die because of substance use related to trauma.
Yeah, absolutely. And I like the little hint of autonomy there for people having their own autonomy and having the decisions, because a lot of times we view them as like bad people and they have to do this or that, but they are still people with their own autonomy. And I think that's important that you highlighted that.
Absolutely, definitely. We should put the choice in the person's hands. I can give you the education and the tools and the resources, and it's up to you what you want to do with that.
Yeah, absolutely. I feel like it seems like a lot like the Portuguese model of harm reduction around drugs, which is which is pretty revolutionary.
Yeah,
Yeah,
that
hopefully we
is
can.
groundbreaking work in Portugal. And with that, they have even seen HIV and hepatitis C rates reduced because we know that IBDU um, causes some of the highest rates of HIV and Hep C. So yeah, way to go, Portugal.
Absolutely, absolutely. Okay, so taking you back to regular questions for a while,
Yeah.
what does public health mean to you?
Public health to me means community. It means um, taking people with lived experience and trusting them enough to serve their community and to meet the needs of the community.
I love it. I love it. And then also, like when I first connected with you on Instagram, you were heavy into. I think you're probably still heavy into the marathon running, triathlon
Yeah.
running. So how do you get into all of this?
I actually got into it because of my addiction. So it was kind of addiction replacement, right? I wasn't using substances. So I needed something to occupy me. I needed something to get rid of that anxiety and just that impending doom of living in society. It's really hard. And running did that for me. I am still heavily into it. I don't race as much as I did before. Um, just because the pandemic really threw things off for us, but I'm actually planning my run after we are done here. Because it, it keeps me um, it keeps me whole. It reminds me that I'm alive, the sweating and my heart racing, and the feeling exhausted calms me basically.
Okay, okay, awesome. If you feel comfortable, what was your drug of choice, and then how did you get introduced into the running to get in, to like do as a replacement therapy of sorts?
Sure. So my DOC was heroin and then alcohol. And I saw this posting. This is not even where I wanted to go with my public health career. I wanted to completely forget about it. I didn't want anyone to know. I'm like, I get to start this whole new life, this whole new career, and I didn't want anyone to know about it. But then I saw this posting while I was finishing my internship, and it was so inclusive, and they wanted people with lived experience. They wanted people that identified with the LGBTQ community. Um, so I said, what the hell? Let's just find out what this harm reduction thing is all about. And so I applied and I started doing my research about what harm reduction was and how I was actually already applying it to my own life. I just had no idea that it was harm reduction as we know it now. And I got the job. I wasn't even done with my MPH yet, and they were so happy to have me on. And it's just grown from there. But I know that it's my lived experience and me having experience with being houseless and going through all of that is what drives me and what has led me to where I am now.
Okay, awesome, awesome. And you're doing great things. I fully endorse everything that you're doing, and thank you for being honestly so transparent, because I know that might have been tough for you, but
Yeah.
I like to ask these kind of questions if you're comfortable answering, just because somebody else out there might be dealing with the same thing, and just to see someone that is doing such great things, and coming out on the other side, and it could be very helpful to them. So thank you so much for that.
Yeah, of course.
Okay. So you got your bachelor's in sports sciences at the American Public University. So what was the thought process for this?
That thought process was I really like running. I really like sports. I really like this. I thought that I would land somewhere in the recreational side of public health things, teaching healthy communities, healthier, tracking obesity rates within Louisiana. We have high obesity rates. And so just ending up somewhere in the recreational system and promoting being healthier through physical activity in my state.
Okay, awesome. And you chose to get a concentration in health and wellness. Was there any particular reason for this beyond just, you know?
None. I think I did it because I mostly wanted the nutrition parts of things. And if I tacked on that health and wellness, I was able to take those nutrition classes and then maybe somewhere along the line I could apply it to what I was wanting to do. But I will tell you, the whole time that I was getting my bachelor's, I was like, this is great. Physical activity is great. Yeah, we should have sidewalks in our community, but this doesn't excite me. On I'm not on fire for this.
Yeah, I think that's absolutely fair, and I feel like a lot of the times going into your bachelor's, you think that you want to do something, or you do something because you had some like small interest, like running, proof of chance. Like for me, I went to my bachelor's because I like dogs, so I went as a
Yeah.
pre-vet. But that doesn't make any sense. So I can completely resonate with you, not like breathing your fire for that. So were there any takeaways that you did have during your bachelor's that you did want to share with us all?
I did. I learned that, yeah, I really am invested in my community's health. I really am invested in rural health. And that's one thing that stood out to me whenever I was studying for my bachelor's, is that there's a stark difference between urban and rural communities and the access and how they are disproportionate between urban and rural. And growing up and living in a rural community, I realized that I can't just hop on a transit and get to a health unit to get an HIV or STI testing. I can't utilize sidewalks for walking and running. Is vastly different to what I'm doing now, but it led me to where I am now. The discrepancies that exist in rural communities, and I knew that I was going to do something with that. I had no idea that it would relate to substance use, but I knew that I belonged in rural health, in public health.
Okay, and did you grow up in a rural area in Louisiana as well?
I did. I grew up in Terrebonne Parish, Dulac, Louisiana. And after Hurricane Katrina and Hurricane Rita, I was 16 years old, and me and my family had to move out from where I was born and raised. And we moved just further into town, maybe like 30 minutes away from where we are now, because my family won't ever move there. We are a part of a local tribe there. It's the Homas Indians. And my family just won't ever leave. And even the town that they are in now is still pretty rural considering other urban areas that are there.
Okay, and I'm sorry to hear that about the hurricanes. So then you graduated, and then you went into the US Marine Corps. So, so tell me about that process. Tell me about that.
So when I joined, I was living out of my car, and my car was going to be repossessed. I mean, speaking of transparency, I'm going to be super transparent. I was living, showering, eating, brushing my teeth out of my car. I had nowhere to live. I was in Charlottesville, Virginia, going back and forth between Waynesboro and Charlottesville, Virginia. I knew no one. I ran away from home. I was 18 years old, and I knew my car was going to be repossessed, and I didn't know what else I was going to do. And someone there said, "Hey, you should join the military." And they recommended the Navy to me. And when I got there, I was like, no, not the Navy. Like, I need something a little more hardcore. And so I settled on the Marine Corps. And I did it, and I shipped out a week later. 13 weeks later, I was the United States Marine, and then got stationed in Camp Lejeune, North Carolina.
Okay. And what was that process like, getting into the Marine Corps? How tough was that for you?
It was pretty tough because I had been arrested, so I had a record. There was a lot of things that had to be addressed as far as that went. Hiding things on my record, they did that for me. I don't know if I'm even supposed to say that. My drug use, they covered up my drug use for me. They didn't do a drug test. I still look back and I think, wow, I'm so grateful for that recruiter, because he saw me in the situation that I was in, but he also knew this is a kid that's just looking for sanctuary. And so he did everything possible to get me in. And he hid paperwork and signed paperwork. And he was like, "Can you be out of here in a week?" And I said, "Yes, let's go." It happened so fast is how it happened for me. I was sworn in and shipped off to boot camp. I cried at boot camp so bad, very emotional, being broken like that. And it was a whirlwind. I mean, my whole entire life was changed. My thought process was changed. Would I do it again? Would I recommend it to any woman now? No, it was the hardest thing I've ever done in my life.
Okay. Harder than training for the triathlons?
Harder than training for triathlons, yes. Because there's the emotional side of it when they're breaking you. So definitely harder than a triathlon, because no one's screaming at me to finish the triathlon, right?
Yeah. Well, shout out to that recruiter for helping you out getting there. Definitely probably helped a lot. I was gonna ask something and I forgot. But anyway, so where did you serve outside of North Carolina? Was it North Carolina the only place that you served?
Yes, that was where I served. I also went to Fort Leonard Wood. I think that's what we call it. Fort Lost in the Woods is what we used to call it. So Fort Leonard Wood, and that's in Missouri, North Carolina, Virginia, and that's it.
Okay, and I do remember the question now. So I was gonna ask you said how it like changed your mindset. So like explain how going through this process and being in the military changed your mindset or
Yeah,
being a
so
Marine.
you become this you become their robot almost, right? And you become obedient and you just yes to everything. You don't really have much of your own personality. It's just who they want you to be, what they want you to be. Um, and looking back now, you know, things that they make you believe about war and politics um, is not something that I, as a person, would ever co-sign with. Now I understand war as a tactic of oppression and how we recruit people that are mostly oppressed by their government. And so to think of the military as a job or as it helping me, that's hard for me to grasp today as a sane person. But they instill that in you when you join.
Okay, that is fascinating, and it's definitely not something you hear from a lot of veterans. Definitely some of them, but not a lot of them. And I think that just speaks like to you wanted to speak power to the system, and you know like really just sharing what you think and what you've learned and the experiences. So I appreciate that, and I appreciate all the transparency there. And you were going to say something, so please do.
Yeah. Oh, I was gonna say something.
I think so.
No, that was it. You know, just highlighting the system and the abuse of power that comes with it. I'm thankful every day for my military service, no doubt about that. But I also know that there can be mistreatment behind it too.
Awesome. Um, no, another question was because I remember one of my colleagues who I worked with in Alaska was saying something along the lines of like in the military you don't see like skin color, you don't see like gender, you don't see all those kinds of things, which I thought was like ridiculous in itself. But being a queer lesbian lady in the military, how did that all affect you? How did you cope with that?
Yeah, your friend's absolutely right. You know, sometimes you would hear them say things like, well, there's no color because we're all in the same uniform. That is a real thing. Um, we're all the same color because we're all wearing the same uniform. And that's how you have to think. We're all uniform. There's no time or room for diversity because that is taking away from the mission. And the mission is what? War and to kill and to fight. Or at least in the Marine Corps. um, so yeah, I mean, absolutely, your friend is right. And as far as being a woman, um, yeah, that doesn't matter. You're going to do the same things that we're doing, and you're going to be treated as roughly and gruntly as the rest of us are being treated.
Okay. Yeah, and I think as you said that made a lot more sense. Like not wanting them to have a thought about something else other than the mission at hand, and rather
Right.
keeping everyone unified. So that does make sense.
Mm.
Um, were there any experiences or things that you wanted that you learned that you wanted to share from your time in the Marine Corps?
Um, no, 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 I don't. It's just, it's, I will just say that only 4% of the Marine Corps is made up of women. They have a very low rate of women serving in the Marine Corps, and it is very rough. And women don't get heard. Women are not believed when we speak out. Um, I wouldn't recommend serving to my dearest, closest friend. I would never.
Okay. Well, thank you for sharing that. Um, And then you got certified as a therapeutic recreation specialist. So how do you find out about this? And then what was the certification about?
It was for it was for people with HIV and hepatitis C and people who use the substances. And it was offered to me through AIDS United, but it was more along the lines of like have you ever heard of U equals U training? Yeah. So that's what it was offered through me for. And I said, yeah, sure, free testing and credentials. Yeah, let's do it. Which happens a lot through my HIV and STI program. They're constantly putting you through training, and they're constantly wanting you to attend things to accelerate your career. So I always take those things up.
Yeah, as you should, You should never turn down a professional development or learning opportunity, especially if the work is advocating for you to do it. So
Absolutely.
definitely. So any big learning takeaways that you wanted to share about this certification?
Yeah, it's offered me the opportunity to go out into the community where people are. So what we are allowed to do with that is, instead of asking people to come to the organization, we get to go to where they are. So let's say we have, for example, this place called Abraham's Tent, and there are community feedings every day at 11 a.m. until the food runs out. And so it allows me to make that a site. So I get to go to that site and I get to work with the communities right there. They're already going to be there because they're having lunch. So why not use that as an opportunity to meet up with them and offer them the services that we have as well?
Yeah, it's awesome, and I didn't know about that, so I'm glad that you mentioned that, and I hope other people are listening and look up that certification and see if they can go about and get it.
Yeah.
So after the certification, you went on to get your Masters of Public Health at the American Military University, American Public University. I'm
Yeah,
guessing it's the same.
they're both one and the same. Yeah.
Okay. So before I ask your thought process on that, how do you find out about public health?
It's very weird. I think I did a Google search, to be honest. I didn't really, I mean, I know that my university offered it, but I didn't really grasp the concept of what public health was. So I just started doing some research on my own, Googled it, and then I applied for the program, and the admissions gave me more information as, my application process went along. So it was really my university that helped me a lot, but also just good old Google.
Yeah, fair enough. And what was the reasoning behind pursuing like a master's level degree? I should ask that.
Um, I just finished my bachelor's. I was working at a laundromat with my grandma. She owns her own laundromat. And I just noticed things while I was there, just like community things, like people who would come in, and I noticed it was like 8 o'clock at night and we're at the laundromat, right? And kids are coming in and buying Cheetos, and he's like, this is gonna be my dinner tonight. And in that moment I was like, what are we doing? I thought about SNAP programs, and I thought about TANF, and how families are not having that offered to them when they need it. And so they're inadequately able to offer dinners and provide meals. And I'm like, what are we doing? What as a nation are we doing for the health of our communities? And it just exploded from there, from working at my grandmother's laundromat. I'm just like, no, my community needs more. We need programs, we need policy change, we need all of this. How can I do it? And I typed that in, and public health, because we are everything.
Yeah, I'm glad that the public health gods guided you towards your Masters of Public Health. That's pretty awesome. Also, when in this entire timeline did you start doing triathlons, marathons?
It was in 2017. Yeah, 2017. I hadn't started racing yet. I just started running just for fun. And then I think the first race that I signed up for was a half marathon. And I was hooked. I got a medal and a t-shirt, and there was free food afterwards. I was hooked. I'm like, I'm sold. I want to do this all the time, every month.
Okay, that's awesome. That's awesome. And I guess selfish reasons there for your marathon. Do you have like times that you're trying to beat, or are you
Yes,
yeah?
always. I get so competitive. I can't help it. I do. I try to beat my own time. And then sometimes I want to place like in my age group. It's nice to see your name in the top 10 in your age group. And I think, wow, I'm really healthy. Yes.
Yeah, definitely. And what does training before a triathlon, since that's more intensive than the marathon, what does that look like for you?
Oh my gosh, it's every day. Every day you're either running, biking, or swimming, and it's very time consuming. Um, it's a lot of swimming mostly because I suck at swimming. So I spent a lot of time in the pool versus time running or time biking because I knew I had those in the bag. So it was just a lot of laps at the pool, a lot of food. You have to eat a lot. You have to eat a lot to train like that. Sometimes I would get in from, a half run, like 13 miles, just on a regular Sunday, just running 13 miles for no reason. And I would have stacks of waffles and eggs, and I would just be so hungry all the time. And I didn't realize, I was like, oh, I'm going to do this for weight loss, and I'm going to do this for my mental health. Little did I know you actually gain a lot of muscle. So you gain a lot of weight while you're running and training, which it blew my mind. I was like, what's happening? I thought this was going to be a weight loss thing.
Yeah, like I could only imagine the amount of calories that your body needs to intake doing that.
So many calories.
Awesome. And how long before a race do you train for? Like 3 months, 6 months?
Um, I think it's what was it? It's not really months. Well, it's like 2 months. Yeah, it was about 2 months before I did because I decided August, September, October, November, 3 months. I decided in August that I was going to do the triathlon that I did in November. So it took me 3 months,
Okay.
and then
And
and then I started last minute too. It took me forever to decide, but I already had a running base because I marathon run, so the running was good. I just needed to get my butt in the pool so that I wouldn't drown on the swimming part.
well, I'm glad that you did enjoy on the swimming part, and we can talk about it today.
Me too.
I guess that's awesome. That's awesome. And if someone was wanting to get involved, interested in either marathon running or triathlons, what advice would you give them?
Um, I would say eat your foods. Don't be scared to gain weight. I think especially with women, we get it in our mind that we're supposed to be a certain weight. Oh no, I'm gaining weight while I'm training. Why is this happening? So I would just say make sure that you're adequately fueling your body. Because it's in the kitchen where all the magic happens. And I didn't believe everyone, but you have to fuel yourself. And
Okay.
everything else is just it's just getting out there. It's just time on your feet. Don't be scared of the miles.
Absolutely great advice. So definitely get out there if you're trying to do that. I definitely want to do a triathlon at some point in time. You'll know. I'll ask you for tips and how you cooked your waffles and whatnot.
Waffles are key to training.
I can only imagine. So I look forward to that. Okay, so taking you back, so you went into your Masters of Public Health at the American Public University. Um, did you have a concentration?
I didn't. I did a capstone.
Okay. So you told me about the thought process.
Hmm.
Uh, so what kinds of things did you learn during your Masters of Public Health? What did Google did everything you heard about on Google live up? Did it live up to everything you learned on Google?
It did. Plus so much more. I was so overwhelmed. I did your public health things. I did biostats, epidemiology, policy, healthcare management, um, all the things. I loved it. It was my mind was blown how much public health actually covers.
Yeah.
The public health world is your oyster, literally. I mean, take your picking.
Totally agree. Especially like when you get a handle, or like you see that all these foundational classes such on like widely different fields, but they all overlap in some sorts of way. It's just so many different things that you can get involved in and move towards. So what were the classes or the concentration or the focus areas for you during your MPH that most interested you?
It was definitely the policy and the management side of things, and um, implementing health intervention programs. Absolutely. Those were, I feel like, my three. Um, but especially creating, promoting, and implementing health intervention programs. That was, I love that class. I still, oh my gosh, can I show you?
Yeah,
It's
of
right,
course.
it's right here. I love that class so much. I still have the book, and even now in my career, even with my MPH, I utilize this book. I love it. I do that with a lot of my books from school, because it all applies. But
Yeah,
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 it's my
absolutely.
favorite. It's my favorite book. So of course, it's my favorite class.
And for those that are listening on the podcast, can you read the title of the book for everyone?
Oh yes, it is planning, implementing, and evaluating health promotions programs.
Yeah.
A primer, 7E. I'm sure if there are any students listening that they're probably using that book right now.
Yeah, absolutely. And I think like evaluation is such a key skill in public health and understanding like the basics of all those types of things. It helps you with program planning, program management, and everything in between. So absolutely love that.
Hmm.
Um, And then in preparation for this interview, I did a lot of digging on your Instagram account, and I found a post that you had. I think it was during your MPH program where you're talking about you struggling with your mental health.
Mm.
Talk about the struggle with your mental health and how did you pursue to continue on and complete your MPH?
I did struggle a lot through school. I mean, a graduate degree is no joke, and I had three kids at the time. Plus just personal life things. I started late in life as far as my degree went. Um, so raising three kids, getting my master's really took a toll on me. I time management. Time management did it for me, and also my hobbies. You have to have hobbies, and you have to make time for yourself. You have to get out and do some yoga. You have to get out, take a walk in nature or something. But I knew that the work wasn't going anywhere, but that my mental health was declining, and that it was important that I take care of that so that I can address the work that was in front of me. But it's just it's the load. I did a fast track MPH. um, I didn't take breaks. I worked through the summer. I was determined to get it done, and I knew that it was going to be hard, but I just made time for myself as well and took care of me.
Absolutely important. And I think it is good to like I know for myself when I get in those kind of ruts, it is you have to push yourself to find some kind of consistency in a schedule, whether that be getting outside or running or exercising and those kinds of things
Absolutely.
that are very helpful. So thank you for sharing that.
And I tell my partner all the time, like, you're not motivated to do any work right now. So why continue to sit there and try to make yourself do work for 4 hours straight? Or maybe if I take a walk outside, I'll feel inspired. I can come back inside. I sweat a little bit. I take a shower and then I try again. Sometimes it's not so much that we're burnt out or not motivated. It's just that we haven't taken care of our physical and our mental health. So our body's not going to perform for us if we are not taking care of it.
Absolutely. And then I'm not too sure if this was your capstone, but I have here it's your practicum, and I believe this is the thing that you sent the voice note about the state health assessment for a ship coming in to port, and I was like, what's going on here? Ship, or is it a ship health assessment?
It's a
SHA?
ship. Yes.
Okay, tell me about that because I've never heard about that until you said it.
So OPH, Office of Public Health, did a Shpp state health assessment for Shpp. Shpp is, I think it was SHPP, but it's the State Health program planning. I was an intern at the time. I had no idea what they were talking about. I knew what SHA was, right? There's SHA and CHA and all the other acronyms we use in public health. But this lady had gone as far as to put a huge cruise ship and to use it as an analogy for our state health assessment coming into port. It was wild, the measures that she was going to promote her state health assessment. But I did do that in my practicum. But one thing that I noticed with LDH, which is the Louisiana Department of Health, is that we lacked in our state health assessments tribal communities. We were unable to access those communities because of harmful tactics that we use to work with those communities. And then we had zero data for the LGBTQ community. And what were we doing in our health units to address the needs of our transgender community, of our teen gay community? You know, what were we doing to address LGBTQ health in our high schools? So that was one thing that I addressed on my internship, was that I thought that in our state health assessment, it was really important to include those communities, to start with our tribal communities and then moving on to our youth, our young gay community. So yeah.
Yeah, very, very important. And I think it just shows that even to this day, there isn't that representation or that voice at the table advocating for those sort of data or things to be collected. So
Absolutely not. And even in southern parts of the state, you know, our battle is, it's a mountain, and to get over this mountain is very hard when you are in rural southern areas. We can't even require adequate sexual health education in our high schools. You know, a policy has made it so that we can't even talk about it unless it has to do with abstinence. So we're doing real good here.
Yeah, totally understand and feel the stress across there on that. This it's crazy, but hopefully we can get some changes around that and get some just sexual education all around the country, around the world, to be a little more comprehensive. Abstinence, yeah, abstinence is not well, it isn't the key, but it isn't the key education. You know, like, yeah,
That's
it's not.
right.
Yeah. So then you graduated from your MPH and you went on to become a HIV STI Program Coordinator. So how do you come across this role?
I didn't. It got dropped in my lap. So I actually started out as a harm reduction coordinator and then moved mountains with this program. It was going so amazing. But the root of harm reduction started with HIV for injection drug users. So they thought it would be a great idea if my program absorbed another program. And so then we became harm reduction / HIV STI, where we just are now able to do testing along with the harm reduction parts that we do as well. So one program gave birth to another baby program, and now we are one.
Okay, so you currently work for as I guess both a HIV program coordinator and a harm reductionist.
That's right. That's
Okay.
right.
And you were a harm reductionist before you were an HIV program coordinator.
Yes.
Okay, just confirming that in my head, and in case anyone else was wondering as well.
Yes.
So how I guess so how do you get involved with the harm reduction work?
So just with my lived experience, I started applying and I found Swallowheck. And it was the first time that harm reduction had ever been done in Southwest Louisiana. And they were a little bit afraid that it wasn't going to work. Being in a conservative area, in a conservative state, harm reduction principles don't usually apply. Our response to drug use is incarceration. So to treat people who use drugs with humanity and love and compassion is not something that typically goes on here. So they were afraid how the program was going to work. And I told them, fear not, I am here. We're going to make it work. And we did. And we're here a year and a half later. And um, it's beautiful. We're saving lives. We have just within this past month had 9 people report that they reversed overdoses with the Narcan that we gave them. So we're super excited about that. You know, getting resources into the hands of people who need it instead of having, you know, medication expire on the shelves at law enforcement offices or pharmacy offices. You know, we're actually giving Narcan to people who use drugs, people who can save their loved ones' lives. Um, so that's it. I just threw myself into it. It didn't actually require an MPH, but that's how we grow. Just because you don't need your degree to do it doesn't mean that you can't take what you've learned from your schooling and apply it and make it even better than you found it. You know, I found this program and they were like, oh, this is all we need. I'm like, no, actually we can do a lot more, and we're gonna do a lot more. And it's those 3 little letters that allow me to do that, to use my knowledge to say, hey, no, this can be a lot bigger than what we're doing. I rant, I rant so much. So if I just go on these tangents, you just let me know.
No, you're fine. You're fine. I actually want to ask more about that. So you came into this new harm reduction program, and they're hesitant because it's the southeast, well, South Louisiana, and they haven't been anything like this before. And so you coming into this, tell me about what they were thinking, or like what more you thought they should do.
Yeah, so it was mostly just, you know, give people education about substance use and overdose, teach them about safer injection. And I was like, yeah, that's all good. But they wanted me to do it in spaces where people were hesitant to go, right? So I'm a person who uses drugs. I'm a little hesitant to walk into your nonprofit because it's really nice. And I've been stigmatized my whole entire life. I don't feel comfortable there. So I said, let's make this into a peer outreach worker model. That we hire people with lived experience, we hire people who are actually in active use, and we take them and we bring them out to the community, and we let them share the education, we let them share the resources, because this is their community, this is their experience. I can teach them about overdose, I can teach them about safer education as far as, you know, the literature goes, but I can't teach them about the streets. These are their streets. um, they need to have the tools that I have. They need to have the resources that I have in their hands, and they need to go out into the community and teach each other how to be safe and how to stay alive. So that's one thing that I did change, was that I thought that it needs to be a peer-to-peer approach, and we did it, and it's rocking. It's rocking and rolling. We've just gained funding for 2 part-time positions, um, where these people were just on a stipend-based pay. So they would do outreach and they would get a stipend, cash stipend, good stipends. It wasn't gift cards or anything like that. But we were actually able to make a position for them within the nonprofit, and they were hired on, and now they're employees and they're doing great. And we've seen people turn their lives around and get into treatments, and we've seen people make this their job. So I wanted it to not just be something where we're just giving out pamphlets and we're just giving out Narcan and saying, okay, stay safe now, don't die. I wanted this to be something bigger. I wanted this to be a home. I wanted people to feel like this was a family, and that they are involved and that they are in charge of their community, and to hold them responsible to that.
Yeah, that's really awesome, and I love your idea of like really getting the community involved and empowering them, like you giving them the knowledge and resources that you have for them to do the work that you know that they know better than you, just because they are the experts of what is going on, and the challenges, and they can be candid with all the people that they are experiencing and encountering. And I think that is really awesome. And I love the idea of the peer-to-peer model. So if anyone's listening to this, just advocate, speak up for things that you think are more important, more impactful. And shout out to getting funding to get those part-time positions as well. That is also really, really dope. Really, really dope.
Yeah.
And I hope that they do see the value that you all are doing, because this is good, very important work. And I think that harm reduction is public health in a lot of ways. So I appreciate all the things that you're doing. I appreciate all that you're sharing on Instagram around this as well, because I think we need more people to be talking about this, and especially people with the MPH behind their name to give them some sort of credibility, So
That's right. That's right. Yeah, harm reduction sometimes doesn't get taken seriously because we do work with people who use drugs, or we do work with people who use substances, and I think that we don't get taken seriously as far as public health goes, but it is. Harm reduction is a public health model. There's this little video that I show before I give any classes to like law enforcement or anything like that, but it's this little cartoon stick figure, and I'm gonna have to send it to you because you will totally crack up over it. But it's this little stick figure guy, and there's music, piano music playing in the background, and he's wearing a helmet, he's wearing a seatbelt, he's putting on sunscreen, and he's just saying like, hey, all these things are harm reduction. Mitigating secondary harm that comes from being in the sun too long, riding your car without a seatbelt. And that's all this is. It's just mitigating the secondary harms of something that's already happening anyways. Whether or not we like to believe it, illicit and illicit drug use is just a part of our world. And people deserve to feel safe.
Yes, they do. Yes, they do. Thank you. So you mentioned that you did classes for officers. Who else do you educate around this?
Yeah, I do a crisis intervention training with law enforcement here in Calcasieu Parish, and it's just to teach them how to de-escalate situations with people who use drugs. And I actually have one coming up this August. I'm pretty excited about it because we're not just going to talk about de-escalating, we're going to talk about the harm reduction model. And we're going to talk about how we can stop incarcerating and instead leaving resources behind with them and responding in that way instead of arresting, because not everyone needs to be arrested. Some people just need trauma response, right? Some people are just in a bad situation. Have we checked their housing? Have we checked, food insecurity, things like that. So I'm excited about that training with law enforcement. I also go into the hospitals because we know that stigma in hospital after an overdose is real. There are some really uneducated nurses out there that treat people who are experiencing overdose harshly. And we want to get rid of that because people are afraid to go to the doctor. People are afraid to go into services where they were meant to be helped in those services. And that stigma and that shame is keeping them away from getting the help that they need. So we are finding that people are not responding to an overdose or not taking people to the hospital because they're afraid of the response that they're going to get from doctors and nurses. So this current program that we're working on right now is called the Bridge program, where we actually have a peer worker inside the hospital on call. So when there's an overdose that happens, that peer is there with the person experiencing the overdose to show love and compassion, and then to link them either back to us, to the harm reduction program, so we can take it over from there. And she can also link them to our treatment center if that's something that they are interested in. But either way, that person does not leave without somewhere to go. It's either going to be harm reduction if you have decided to continue your use, or it's going to be treatment and recovery if you've decided that you're done. So I'm excited for the Bridge. That's really cool.
Yeah, that's awesome. You definitely have to share some more on the IG for us all to definitely see.
Okay, I will.
Awesome. We look forward to it. And then you also work with the Do No Harm program. So tell me a little bit more about that if we didn't talk about it already.
We didn't, but Do No Harm is just our harm reduction program. So Do No Harm is the peers, it's the outreach side of things. It gets a little bit nitty gritty because it's more street work. So you actually get to see what is happening from our outreach team. They alert the community when there has been a report of an overdose with a specific substance. So we have a hotline number, and folks will call the hotline number and say, hey, my sister overdosed on this substance. It tested positive for fentanyl, because we give out fentanyl test strips. And then so the peers will take that information and they will post it on IG or on Facebook, whatever platform they decide, to alert the community. Hi, come get test strips, come get Narcan. You need to be safe. This substance tested positive for fentanyl in this area. And we get good traction for that. People will ask then for fentanyl test strips so that they can know what's in their drugs, because everyone deserves to know. So that's the nitty gritty, and they call themselves Do No Harm because harm reduction, because we don't want to do any harm. So yeah, anything exciting happening with the harm reduction outreach program, you can find on our page, SWLA Do No Harm.
Awesome, awesome. And I'll definitely be sure to link that in the show notes for sure.
Yeah.
And then I know we've touched on like the importance of policy for harm reduction. And I know there was a House Bill 166 that I know that you probably have a lot more information I would love to talk about. So I'm going to give you the floor to talk about it.
Yeah, so basically, as it stands right now, anything that we give out is considered paraphernalia. Whether it be fentanyl test strips, whether it be clean syringes and needles for people, it's considered paraphernalia because at the federal level, it has not been approved funding. So we can't use federal funds to buy safer injection equipment. That is only at the state level. We have to apply for grants. And what they've done is they have made it that any harm reduction or syringe service program that is in our state, we're basically competing for all the same money. So we have currently 4 SSPs in the state of Louisiana. So all 4 of us, we love each other dearly, but when it comes time for grant writing and applying for grants, we're all competing for the same money. That's really harsh, because what if one of us gets it and the others don't? And it's just back and forth without that bill passed, without harm reduction being considered at the federal level. It's going to continue to be this way. And harm reduction and syringe service programs are going to continue to fall without being able to provide sustainability in their programs for the community because of the lack of funds. So just recognizing harm reduction as a public health approach to this overdose crisis that we are currently in is super important to our programs being able to continue to offer services to the community. And it's happening. It is happening under this administration. I mean, to me, I consider it the bare minimum just because we know how harsh things are. As I mentioned earlier in this podcast, overdose is the second highest thing killing the community right now after COVID. So for me, it's just the bare minimum, but we are moving forward, and I would like to see syringes be approved in that bill for us to buy with federal grant money. I would like to see harm reduction programs get more federal grant money, and so that we can stop operating in this rogue way, asking the community when you're serving that community for help and for donations and for them to give us things that we can't afford because we're only a tiny little state funded organization. It's not fair. I shouldn't have to ask the community for things that I need to give to the community.
Thank you for informing me on that. I did not know that federal dollars can't go to harm reduction. That's very disheartening. And I guess it just shows the stance that the U.S. just currently has on the policy front around that. But I hope, as you said, like this administration can actually make some change around that, and we can hopefully get some good sustainable funding, because it is very important work. It's like root cause type of work that is very essential to, I think, a lot of other things. And just, yeah, yeah. So wow. But thank you for sharing that.
Of
And
course.
then I know you also wanted to talk about, well, I wanted you to talk about the hashtag end the drug war.
Yeah. So, but first, I feel like you looked this up. I feel like you clicked on the hashtag. Tell me, what did you see?
I did not click on the hashtag,
Oh,
but I would just like, I guess the first thoughts that come to mind is just, as we've been talking, and like the Portugal system, and just having a harm reduction approach to everything is just so important. There is no need for this war on drugs that's incarcerating people that are probably just trying to make a living, or just trying to deal with the circumstances of the oppressive system that are there, and
that's right.
have no way to get out of that, because they are in the system that's just holding them down and just telling them that what they're doing is bad, and having these like drug tests for people going into work, or having drug tests linked to um to like unemployment and things like that is just ridiculous. As a person in the society, you should have the same right as anyone else, whether you're a user or not.
Yes.
Yeah.
That's it. That's ending the drug war. But also, it's recognizing, how the drug war started in the first place. We don't have a war on drugs, right? Drugs are an inanimate object. We can't. This is my favorite thing I've seen published, posted, whatever, in all the times I've dealt with in the war on drugs, is that you can't have a war on an inanimate object. The war on drugs is actually a war on people. We are incarcerating and filling our prisons full of people for punitive drug charges. Small amounts of marijuana have landed people in prison for 20 plus years. Um, I always feel out of line when I say this, but it's the facts. The war on drugs started because we wanted to incarcerate the Black community, period. That is why the war on drugs started. And it's why the war on drugs is continuing today. I can't be oblivious to the fact that the way we have addressed the opioid epidemic and the way we addressed the crack epidemic is two completely different approaches. And sometimes I feel guilty for the money that we throw at opioids that we did not throw at the crack. Incarceration versus treatment and therapy and recovery, billions of dollars thrown into treatment and recovery when billions of dollars were thrown into incarceration on our Black community. So we can't talk about the drug war unless we talk about how it is a race war.
Yeah, absolutely. And it's interesting you brought up that the comparison of like the opioids to the crack epidemic, because that's one of the posts that I wanted to make like early on when I started my Instagram account, because I think public health still doesn't come to terms that how they approach that, how everyone approached that was
Right.
very racist. And when
Do
we
it. Do it. Make the post. Make the post.
you'll see, we'll see. I feel like there's just so much there, and I appreciate you saying that, despite how it makes you feel, because I think it is the truth, and it is hard for some people to swallow that. But I guess I'm just glad that we are moving forward. I guess hopefully like this approach to from the crack to now opioids, and how we are progressing in a more harm reductive type of way continues, and we soon get to that Portugal model at some
Mhm,
point in
mhm.
time.
And I, one thing that I'm constantly advocating for, and so that our program is not rooted in white supremacy, is that we not only offer safe injection equipment to the community, but are we offering safer smoking? Are we offering safer smoking education? What about our Black community that smokes crack? This is not just fentanyl has been proven to be in everything, whether it be crack, heroin, methamphetamine, cocaine. It's in everything. And so if we are only addressing the injection drug community, we are leaving out a whole demographic, which is the Black community, the stimulant use community. And so every time in my monthly reports, I'm just like, we are still not addressing. And that is a call for alarm, because we are harm reduction. We are not supposed to be inducing any harm in the program. We are supposed to be mitigating harm. And if we don't address the entirety of the drug use community, then we're perpetuating harm.
Yeah, I like that a lot. I like that a lot. And yeah, we have to have baked into everything some anti-racist equity frameworks built into there in everything that we do, because I feel like we like unknowingly we do a lot of things that are holding back certain communities. So I appreciate you sharing the light on that as well. And then I also have here like written, we are harm reductionists in this field of public health. So tell me, how do you reduce harm that public entities sometimes perpetuate in spaces where communities are vulnerable and susceptible to health organization abuse?
Yeah, so I work for a nonprofit, and we know that at their core, nonprofits can be harmful. And that is at no fault to us who are just trying to implement our programs and run our programs. But I think it's become this, how many grants can I write? How much money can I get? And it becomes less about community engagement. So I think mitigating risk is blocking that capitalistic, money-hungry mentality that can come from a nonprofit, blocking the community from that. So putting myself in the middle of the nonprofit and the community, so the community doesn't have to feel the brunt of that, you know, because if funding is lost, guess what? Resources are lost. And the community feels that. You get them used to getting free Narcan, you get them used to free HIV and hepatitis C testing, you get them used to free Hep C treatment. And then that goes away. Why? Because a nonprofit lost funding because of lack of what? Administration fees. And so it's going to bat and calling out greedy corporations when they are being greedy, when they are being capitalistic. And it's saying, hey, no, this is more about community engagement and community resources than it is about overhead costs. I'd rather take a cut in salary than have the whole entire program go under. And not everybody thinks that way. You know, you get into the nonprofit world and it does become more about making money than it does become about money for the community. And it's not just money either. It's language. You know, it's allowing the community into spaces where they're not necessarily welcome. It's remembering that we are not the experts in our communities. The community is. And so we need to allow them to have a voice at coalitions. We need to allow them to have a voice to advocate for themselves and what they need. And instead of creating programs around what we want the program to look like, we need to let them tell us what this program needs to look like. We need to have them involved when we go to the funders and we say, this is what we'd like to do. Because they know best, not us. So when we're building, it's important to have the community speak up and share their experience and what it is that they need. So advocating for that, advocating for the community to be involved in building programs is also a way that I try to mitigate the harm.
I like that. Because yeah, they can definitely hold you accountable to certain things and things like that. So that is important as well. And then I guess just to touch on the work that you do as an HIV STI program coordinator, what kind of stuff do you do on that side?
I do testing. So the program is called Stay Positive, Live Negative. And it is just promoting safer sex. But it's the same mindset around harm reduction. It's not necessarily you have to use a condom. That is the only way. You know, we offer other things like risk reduction. You know, if you are being partner selective? Are you holding your partner responsible to getting testing? Um, we do prevention management sites where we bring out condoms to gas stations, to deli markets, wherever the community is. I think right now we're up to 54 prevention management sites. And every quarter we deliver free condoms, and they have condom bowls out on their cash register station, wherever they decide to put it. But people are just free to take whatever they need. Lubricant, it's amazing. My heart is so full with free things for the community. And then we also do free testing for HIV and Hep C, and then we link people to free treatment. We sit with them every step of the way. We work with our Common Street Clinic, which is also the South Louisiana AIDS Council, and people get warm handovers to Slack, and they're loved and taken care of, and there's a sense of community. Anyone who tests positive receives free counseling, and we have parties, we have just gatherings of the community where people can share their experience. At our last gathering, I met a man who was 70, 75 maybe, and he has been a part of his AIDS committee for as long as he can remember. He's like, I was a teenager when I tested positive, and here I am today. He's like, this is not a death sentence. And so we also offer that, where they're allowed to come and speak out at events that we have to just encourage young people to get tested and to know their status, and to start treatment. So it's all kinds of things. It's beautiful.
I'm glad that you're doing that work. Keep it up. Everyone appreciates a free condom every now and again. So
yeah,
yeah, awesome. Yeah. And then moving on to talk about your Instagram account. So it's at Kristen_in a nutshell. So what made you want to create this account?
I was really bored and I needed some friends. It started as what do you call it? Like, it started as a way for people to hold me responsible. I really wanted to get in touch with the running community, and I wanted to check in with folks, other people who were running marathons. I was meeting people who would run these marathons and they're like, oh, are you on Instagram? And I'm like, I'm not. Should I be? And that's what everyone kept asking me. I was like, I guess I should be on Instagram. And then so it just started as this way for me to keep in contact with people that I was meeting at races, and I would post all my runs every time. You can scroll all the way back to when I first started, and it's mostly running pictures. And then it just evolved into this getting my thoughts out about what I'm seeing happening in my community and how I feel about certain aspects of my community, or on certain topics or certain issues. And people liked it, and I realized that people resonated with the same things that I was feeling, and that feels good to know that you're not the only one in a southern state that has progressive thoughts. Is really nice. It just feels like a warm hug. Like, I'm not alone out here in conservative city.
Okay, that's awesome. I'm glad that you started so you can connect with your running friends, and it has grown into like, there's still some fitness stuff in there. I don't see much fitness as much as I did earlier on. A lot more public health, harm reduction stuff there. So do you think that was intentional?
It wasn't. No. It wasn't. It just gradually happened. I don't know why I stopped taking pictures of myself running, but it just seems like there was a bigger picture there. I'm like, okay, this is my ego side of things, but this is just the real side of things. Like, I still do run, and I'll share it on my stories from time to time, but I just felt like there was a bigger message that I had to give, and I didn't want to hide it behind my running pictures. I wanted people to see what I was actually doing, what I was really experiencing, no matter how ugly that might be, or the picture might not be perfect, but all of my captions, I have something to tell.
Yeah, absolutely.
But definitely not intentional. It just gradually flowed that way.
Yeah, and I think that natural progression is good, and we appreciate you being the harm reductionist on Instagram that we all love. So
Aw, thank you.
yeah. Keep it going because
I
we
will.
definitely need more of this, and I feel like a lot of people should be more interested in this type of work, and when they do become interested, you'll be the person that they reach out to get more insights onto that. So thank
Yes, more MPHs in harm reduction, please.
you. Yeah, I hope so. I hope so.
They need to take us seriously.
Absolutely. So then you had a post on your Instagram about harm reduction, workers, and burnout. So do you want to talk more about this and then give some advice on how you cope with this?
Yeah, so overdose rates have just accelerated. And I got to a point where I was really exhausted. I would get the coroner's report almost every morning. And then I had to ask him, can we push it back that you give me the weekly reports? And then it got to the point where I was like, don't give me the reports at all. I can't handle it because I started to see personal names in these reports. And it just became too much for me because it was at least we were averaging 4 overdoses within 2 days. And that was happening every week. And I didn't want to get up for work in the morning. I was overworking. I felt like I was responsible somehow. How am I not getting enough Narcan out into the community for this to not be an issue? I felt guilty. I felt personally responsible, and that there was a disconnect somewhere between the work that I was doing and the lives that I was trying to save. Something was disconnected. My program's not sufficient enough. I was just taking things really personal. And so I stepped away from the reporting. But then something else I realized is that throughout this past year and a half, I had stopped running as much as I was. I had stopped gardening. I wasn't doing things that brought me joy. I wasn't baking my bread. Um, and so I returned to myself. You know, it's almost like an identity crisis that you go to when you start to relate so much to your work, when you give so much of yourself to your work, you lose your personality and your characteristics and your hobbies. All of those things start to go away. And I just felt consumed by the work that I was doing. And I had to stop doing that because I wasn't using drugs anymore. I wasn't drinking alcohol anymore. And so I shouldn't have felt that way. I wasn't responsible. I wasn't killing anyone. My program was doing exactly what it needed to do. This is not my fault. This is a policy failure. And me hurting myself and my mental health is not going to save my community. Um, Me not taking care of myself will hurt my community and it'll hurt my program. So I realized that in order for me to have my program be adequate and functioning properly, that I had to take care of myself first and make myself feel better first. And doing that was not abandoning the work, or it wasn't abandoning the community. It was just me being able to fully show up healthy for my community. So
Yeah, absolutely. And you show up in your position fully as yourself a lot of the time, and that is draining in itself. And as you said, like you felt the brunt of all the deaths that were happening, all the overdoses that were happening, and that is tough knowing that you are trying to work through that, and you're feeling like this is your fault. But yeah, it's never a program's fault. It's always the system's fault. The system was set up in a way that we need these programs to try to help people, but the system should be set up in a way that this is the default, setting, and it is not. And so you're doing great. You're doing great. I just want you to know that I think you're doing
thank
great.
you.
I think everyone else that listens to this is going to think that you're doing amazing things. So
Thank you.
you keep on doing you. Take your time when you need it, and Yeah, thank you for sharing that, and I'm glad that you were able to reconnect with all the things that make you happy. So what kind of bread do you bake? Is it sourdough?
Sourdough, of course. How did you guess?
I've seen some of the stories for sure.
Yeah, it's
Okay.
definitely sourdough. It's so good.
Yeah, and what got you into baking?
I don't remember. I think someone else on Instagram actually influenced me to do it. And she's a great person. I love her to death. But yeah, she inspired me and I took it on and my breads have come such a long way. They were ugly. They were ugly. My kids were like, "Are we supposed to eat this? It's really hard."
Well, I'm glad that you did come a long way, and hopefully sometime I could try out one of those sourdough loaves.
I
That'd be awesome.
mail. I can mail you one.
Oh,
Yeah.
okay. We will definitely connect. I can talk to you that. Awesome. Um, so having this Instagram account and going from like the your fitness wellness towards public health harm reduction, uh, are there any things that you learned that you wanted to share with everyone?
um, yeah, don't take yourself so seriously. Just have fun. It's so much fun. It's so much fun meeting so many people. I mean, I met you when I was fresh into my program, and all I did was just look for people who were in public health. And it was so great that your name actually has public health in it. But I don't remember how I found you, but it's this great device where we can learn from each other and share ideas and to be free and discuss and it's amazing. Enjoy it for what it is and don't let the negative side of it get to you. Use it as a tool. Instagram is such an amazing tool to advance your career and personally advance yourself too. We should always be promoting ourselves as MPHs. To promote your programs that you do for you, whether it's nonprofit, whether you work for the state, whatever it may be. It's an excellent tool for promotion. So yeah, that's what I would just tell folks to really utilize it.
Yeah, absolutely. And I think that's so important not to be so serious. I think a lot of people are very serious. And I think we deal with a lot of serious issues. It's okay to be a little weird sometimes. And
Yeah, let's get weird on Instagram about public health.
let's do it. Let's do it. Okay. Before we go on to the last section of the show, where would you like to see yourself in the future?
Oh my, I would love to be an ED of a program, wherever that may be. I don't want to land there. I don't want to finish as an executive director, but I want to run my own program outside of being under the thumb of capitalistic organizations. That's the dream is to just have my own entity. Um, but next step for me is definitely director.
Okay, awesome. I look forward to that, and I also look forward to your future triathlon training, marathon trainings, and
That
seeing that.
too. Oh yeah. I mean, not just career wise, but um, training wise too. I'm trying to get it back up into gear. I'm trying to build my base back. I've been running consistently, so hopefully there will be a medal soon in one of my pictures.
Awesome. We look forward to it, and we will be cheering you on wherever you are. I mean, or
Thank
swimming, or
you.
biking, or all three.
Yeah, thank you.
Yeah, my pleasure. So, moving on to the Furious Five, the five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say keep a journal and keep a planner and keep at it. It's hard, it gets tough. Time management is your best friend. Don't put things off, actually get things done early. And yeah, my planner was my best friend. Scheduling things ahead of time to have them done, whether it be a day early, 2 days early, that a way that you can make time for yourself to decompress from the work that you're doing.
Awesome advice. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
I would say you have to have a big bleeding heart. Community work is personable. So if you're going to do this, I would say that you have to have a personal investment within the community. Yeah.
Absolutely. Number three, what's something you are working on improving in your life right now?
Consistency. I'm having a really hard time with that, and I think that came with the pandemic. But that's it. Yeah, consistency. Working on my consistency, showing up every day, but also giving myself a little grace if I'm not 100%. Maybe I might be 97%, but I still did it. You know, maybe this day I'm only 88%, but here I am. I did it. So just keep it on.
Yeah, like as if you improve 1% every day in 365 days, you'd be 365% better. So
Oh yeah, I like that.
yes, consistency is key. Number four, professionally, do you recommend anything
Professionally, do I recommend anything?
besides?
Invest.
No, sorry.
No, go ahead. You go.
I was going to say just besides your program evaluation book that you plugged earlier.
Oh, I did. Yes, everyone get that book. It's amazing. I would say invest in yourself personally. We give a lot of ourselves to organizations. We give a lot of ourselves to the state as MPHs. You know, we are government workers. We are nonprofit workers. We are NGO workers. But we can also work for ourselves. As an MPH, our minds are our greatest assets. And I say invest in yourself always. Even if you are with a nonprofit, even if you are with the state, always invest in yourself. Always take that extra training. Always be on the lookout for your next move. Never settle.
Awesome. I love that a lot. And last but not least, where can people connect with you?
The best way is through Instagram, but also I love to give out my email. I love emails. So I can give that to you and you can share it as much as you would like.
Yeah, of course. And if you want to say it or spell it out, that's fine as well.
Sure. It's Kristen K. Actually, it's my last name. Look at that. I already messed up. It's Gonzalez. It's Gonzalez, Gonzalez, Kristen, Kristen, period 02 @ gmail.com.
Awesome. And I'll be sure to put that in the show notes for anyone that would like to reach out to you for sure. But thank you so much for hopping on the show and sharing your story and being transparent and sharing about harm reduction. And I just think it's really important work, and I'm glad to have you on and tell your story.
I appreciate you so much, Amari. I really do. I love that you wanted to share harm reduction as a part of the public health community. I appreciate you so much.
Oh, don't worry. We definitely have more things to do around harm reduction and things in the future. So we'll definitely link up and do some other things.
Awesome.
Yeah. Awesome. Okay, so housekeeping items, everyone. Thank you so much for watching. Make sure that you subscribe, make sure that you like, make sure that you leave a review, share this with a friend. And if you want to support, you can go to buymeacoffee.com/the PH Millennial.
I love it.
Peace out, everyone.